I'm very honored today to be here with Peter Sprague from the Family Research Council. Peter, I met you in Alabama. We were both there to talk, to share our concerns and to testify about the Vulnerable Child Protection Act, which would stop children from being medically transitioned. And again, it's one of those experiences where I'm just astonished with how the opportunity to talk to you, because you're the kind of person that 2 years ago I never would have thought that I would sit down and have a conversation with. And yet I found you to just be one of the most loving, kind, caring, and compassionate people that I've ever met. And you're doing work to protect children right now. So one of the reasons that I was really interested in talking to you is because I feel like you have a lot of insights about parental rights in regard to transitioning children. And I was wondering if you could maybe explain what is happening with medically transitioning children and some of the concerns for parental rights.
Well, it's interesting because there's a twofold dynamic with respect to parental rights in this issue. Our concern from the Family Research Council's perspective is that in a lot of cases, parents who are perhaps reluctant about having their child undergo a gender transition are being pressured into believing that this is the only answer for their psychological difficulties. That somehow, you know, and the worst case scenario of that, which I think is really unconscionable, is parents being told, look, if you don't do this, your child will commit suicide. So basically you can, you know, you have a son, you know, they say you can have a dead son or a live daughter. I think that's really cruel manipulation because it's not founded in the facts, for one thing. There has been at least one case here in the United States of a girl, a 17-year-old, I believe it was, who was actually taken away from the custody of her parents by a court and given to the custody of her grandparents, who were more sympathetic with her desire to transition. So that is, we are very concerned that that kind of ruling could spread more widely across the country. And we believe that parents have an essential right, a constitutional right, in fact, to make the most important decisions for the care of their children, including the care of their psychological and physical health. And we do not believe that it is ever medically necessary for someone to undergo a gender transition. We at Family Research Council are very concerned to protect the rights of parents to control the upbringing of their children and their responsibility for their psychological and physical health, and to resist any suggestion that parental rights should be overruled in those cases because this type of transition is somehow medically necessary. Now, it was interesting in the case of the bill that you and I were lobbying for in Alabama. There were some people who kind of tried to turn this issue of parental rights around.
Exactly, and that's where I think a lot of activists are saying, wait a minute, you're advocating for parental rights, but then you're trying to undermine parental rights by telling them that they are not allowed to medically transition their kids. So if you can address that, because I think that that's one of the things that concerns people is that we don't want to take, I don't want to take parental rights away, but there are cases where we do take parental rights away. So maybe you can talk about how it is that you can have that sort of a polarity in your perspective.
Yes. So our response to that is that there are obviously parental rights are not unlimited. Parents do not have the right to abuse or neglect their children, for example. And our belief is that essentially these gender transition medical procedures constitute the kind of harmful action that justify government intervention to override the parental decision-making or parental choices. There are a number of areas where we do this. We don't let parents drive their children in cars without car seats and seatbelts,
Really simple. Yeah.
because we're protecting the children's health and safety. We don't let parents provide their children with cigarettes or alcohol or drugs, even if it's consensual there, because we want to protect the health and safety of children. And so we feel that prohibiting gender transition medical procedures for minors, such as the application of puberty blocking hormones, cross-sex hormones, or gender reassignment surgery, is the same as prohibiting sort of other dangerous treatments of children. Even with their parents' consent, we feel there's a legitimate reason for preventing that. Now, I want to emphasize we're saying that only about these actual medical interventions. We are not saying that it should be illegal for a parent to support and facilitate their child in undergoing a social transition, a gender transition in terms of the name they use, the way they wear their hair, the kind of clothing they wear, how they identify themselves and present themselves. We're concerned about that. We don't believe that people should change their gender identity or present a gender identity different from their biological sex. But we don't think the government should intervene with that if that's all that they're doing. That is within the realm of sort of the consensual relationship between parent and child, the idea of a social transition. But these medical interventions are very specific. They have very specific physical health consequences, and we believe that those are serious enough to justify government intervention against those procedures.
Yeah, the damages done by medically transitioning a child are profound. I don't think people realize that these children are going to have lifelong medical complications as a result of these drugs and surgeries, that this is not some kind of innocuous cosmetic surgery or socially transitioning. These are kids who are going to be damaged. And one of the it's funny because you talked about not wanting to impose upon parents about socially transitioning. Part of my mission is to get information out to parents because of this narrative that the transgender activists have done such a good job of being accepted that a child will kill themselves if they're not allowed to transition. Because I think most parents don't understand that at the heart of the desire to transition is self-hatred. And so for me, my mission is to educate parents so that when a child wants to transition, they're not saying, oh yes, we want to be supportive and loving, but that they have some other options. And I believe that you came up with a parental research guide on these issues. Is that correct?
We have a parent's guide to the transgender movement in education specifically. Mm-hmm. That was sort of a response to some of the controversies that had arisen, particularly right in the Washington, D.C. area, in Fairfax County, Virginia, which is a large school district in suburban Washington. They were adopting sort of pro-transgender policies beginning about 5 years ago, and there was a lot of controversy about a lot of citizen activism against what the board was doing there, the school board. And we did write this piece on Parents' Guide to the Transgender Movement in Education, and that would be available on the FRC website at frc.org.
And that's really important because I think very few parents really understand what's happening in the schools, and that a lot of times these kids are not, I was diagnosed with gender identity disorder. I had, a diagnosis, a psychological evaluation at school, which probably wouldn't even happen now because teachers would assume that a child who's transgender is on a normal developmental path. So the whole approach is very different. But if kids are told from the time they're in kindergarten until high school that it's possible to be born in the wrong body, that's a message that gives them sort of an interesting escape if, for whatever reason, they're unhappy with who they are. And so I'm glad that that's something that you're working on. Can you expand a little bit on sort of what parents can do, what they need to know, and how to maybe get more involved?
Well, one thing that was happening back in 2016, which was, I think, when we wrote that pamphlet, that was actually during the last year of the Obama administration, and the Department of Education in 2016 had issued a letter, a guidance letter,
Yeah.
yeah, saying that schools should recognize a student's preferred gender identity, and that if they didn't do so, they would be in violation of Title IX, which is the law, federal law that prohibits discrimination on the basis of sex in education. This is the law that was passed in 1972 that is perhaps best known for expanding athletic opportunities for women in high schools and colleges and so forth. But it's been twisted into saying, that gender identity is part of sex, and therefore gender identity discrimination is prohibited under this 1972 law. Now, the members of Congress who passed that law in 1972 were not thinking about gender identity.
It's so ironic, because what they're doing is they're using the legislation that gave girls opportunities in sports and protected them, gave them separate facilities. They're using that now to really undermine girls, and it's pretty, like, as you said, I don't think the members of Congress had any concept that this would ever be used in this way, that it would allow any male who claimed to believe he felt like a female to participate as a female in sports and to use female locker rooms. To me, I'm so surprised that feminists aren't up in arms about this.
Well, some feminists are. There's kind of a division in the feminist movement, and there's a group, Wolf, Women's Liberation Front, that's been a feminist group that's very active in opposing a lot of these transgender things, because they rightly recognize that the feminist movement was intended to protect the rights of people who are born female, not simply of people who identify
genetically female, we should probably say, because, and that's something that I just find, I was actually talking with a woman today who's unfamiliar with a lot of what's happening, and I was trying to explain to her that it used to be that someone was transgender, and I would 100% say that people who are transgender deserve all the same civil rights as anybody else, that transgender as a category is something that that I understand. But the narrative now isn't that someone's transgender, it's that they're born in the wrong body, and that they actually are the other sex that they feel like they are, which is just basically not true. I mean,
Right. Well, so yeah, that's one of the things that in this pamphlet that we're talking about was to explain that this interpretation of Title IX was incorrect. And fortunately, very soon after the Trump administration came into office, they reversed that guidance. So one thing is to know that the federal government, the position of the federal government, the position of the executive branch of the federal government is that this is not required under Title IX. Now, there are some Supreme Court cases that we're waiting for a decision any day now on, which are closely related to this. They're not in the Title IX context, the education context, but in the employment context. But it's similar.
And whether or
argument.
not somebody is defined as a male or female based on their chromosomes or their feelings.
Well, and whether discrimination, so-called discrimination based on gender identity, is a form of discrimination based on sex. Our position is that discrimination based on sex, which is illegal it's illegal in employment under the Civil Rights Act of 1964, it's illegal in education under Title IX, that discrimination on the basis of sex means discrimination for or against someone because they are biologically male or biologically female, not because of what their gender identity is. That's not what we mean by discrimination on the basis of sex.
Or how they choose to express that, because to me, this is all about cosmetic presentation. It's not about how you're born.
Right.
And so one of the things that I think about protections is that they're for things that someone does not have control over. So you don't have control over the color of your skin. You don't have control over your sex. Those are things that you're born with, and that discriminating against somebody based on things that they have absolutely no control over, I think should be illegal. But when you take it that next step and say, well, you can't discriminate against someone based on how they choose to exist in the world, it gets a little bit more dicey, because like in the situation where the baker he's a Christian baker, he doesn't want to bake a cake for a transgender coming out party or something, and they're trying to say that that's discrimination. I can't imagine the same people would say that he should be forced to bake a cake with a Nazi symbol on it.
Right.
So it's sort of like, it goes beyond, at this point, it's about sort of, we get to make choices about how we exist in the world. And we also should get to make choices about how we respond to others in the world, and not be told that we have to use a certain pronoun for someone, that we have to deny biological reality in order to make somebody feel better.
Right. Yeah, I agree. And so other issues that arise in the school context that we talked about is that, well, and arise in other contexts too, though, is the issue of the bathrooms and restroom showers and locker rooms. And the assertion that that a transgender person should be able to use those facilities, those sex-separated facilities, on the basis of their gender identity rather than their biological sex. When we feel that that's a threat to the privacy of other students who use sex-separated facilities because they want to be separated from the other biological sex. The reason those exist is because of differences in biological sex, not because of differences in so-called gender identity. And then also the sports issue. Obviously, that's an important thing in the school context. And there is another important lawsuit underway right now where, again, recently the Department of Education has intervened in support of several biologically female athletes in Connecticut who are complaining about the fact that a number of track and field championships in the last couple of years have been won by biologically male students who competed against females, and that this is fundamentally unfair. So all of these are part of our concern and part of our recommendations to try to. We want parents to be aware of the issues and aware of what their rights are on these issues, aware of what the facts are on these issues. But then we also want them to be responsible in how they raise their concerns. You sort of go in a stepwise fashion. If you've heard about something in the classroom that concerns you, you can talk to the classroom teacher first, talk to the, if you don't get satisfaction there, you talk to the principal. You don't get satisfaction there, you can go to the superintendent or the school board. And if you don't get satisfaction there, then you might have to consider some sort of political action or legal action. But there's a step to take. One thing we always want to emphasize, and we have emphasized, especially in the school context, especially with minors, is that every student should be treated with dignity and respect. And so, including transgender students, even if you disagree with what they're doing or how they're choosing to live their lives, everyone should be treated with dignity and respect. But that doesn't mean that they have to be given everything that they demand. In the case of, there was a lawsuit, a prominent lawsuit that's kind of gone back and forth in the courts in Virginia, in Gloucester County, Virginia, where I think what the media has not done a very good job of explaining is that this school district bent over backwards. In this case, it was a biologically female student who identifies as male. And the school district bent over backwards to provide facilities that could be used by this student. It's not like they just said, well, you're female, you have to use the girls' room. They said, you can use the nurse's office, you can use the faculty restroom, you can do, they gave all sorts of options. And none of that was good enough because it didn't involve actively affirming the gender identity that this individual professes. So realize that a lot of this is not just about making sure that transgender students can have a successful educational experience. A lot of it is about making an ideological point in favor of the transgender ideology.
Right. And that's something that I think a lot of people don't understand because of the way the media covers these stories. For example, I live in Utah, so Idaho's right next door. And rather than covering in the news that Idaho passed a law that requires biological males to compete against biological males, the headlines are that Idaho has banned transgender students, which sounds horrible.
Yeah.
We don't want to ban transgender students. And so I think the way the media spins these stories really has shaped the public opinion and garnered a lot of sympathy. And yet, as the case you're talking about, that this student was given a lot of accommodations, but they don't want accommodations, they want affirmation.
Right.
But one of the concerns is that as you're treating one student with dignity and respect, sometimes that means that you're not treating other students with dignity and respect. And I think this is a case where you have this kind of collision, where if you have a kindergarten child who identifies as transgender and perhaps is wearing a packer to school, which is an artificial penis, which they make for kids as young as kindergarten. So if you have a little girl who's wearing something like that to school and wants to be able to go use the boys' bathroom, that sets up kind of this conflict where how do you give that child dignity and respect, but also honor the other children who are uncomfortable or confused by this child. And I don't have any good solutions for that, because I have compassion for both that child who's coming in to school with a packer, because clearly that child's been influenced by parents. A child isn't going to come up with that on their own. And want to also respect the other children who might be really confused by that, and also the safety of that child who might be going into male bathrooms where they're not necessarily going to be safe.
Right. Well, I mean, it's all, these are complicated issues, but I think we should respect the efforts of local schools and local school districts to grant accommodation, as you said, without necessarily granting full affirmation of the entire ideology that's behind this. And so that's something that we do really want to emphasize in all that we're doing. Is this is not about somehow punishing people for being transgender. It's about not punishing people who believe that there is a place for sex-separated showers and locker rooms, or people who believe there's a place for sex-separated sports, and so forth. So
it's interesting to me when I think about it, because as a child, I was diagnosed with what would be considered a mental disorder. But the narrative now is that a trans identity is not a mental disorder. And in some ways, I just see that as really undermining our ability to accommodate these kids. Because if a child has a mental disorder and needs accommodations, there are federal protections for that child. They can get an individual education program. They can get protections, is it a 504 program, things written specifically to accommodate that child. For instance, if there's an autistic child who needs to eat in the lunchroom or in a classroom rather than going to the lunchroom, a plan can be written based on them having that diagnosis. And so if activists were willing to say this is a mental disorder, and we're going to write a plan to accommodate them, it seems like that would provide educators with a lot more flexibility to help the child. But unfortunately, they're adamant that this is not a mental health issue. It's a normal developmental path. And I think that that's really how it's gotten very confusing.
Yes, and coming back to your first question about parents and the role of parents, I would say to parents who have a child who is professing a transgender identity or expressing some sort of extreme gender nonconformity, that the first question is not, what name would you like to be called? The first question is, what is causing this? Where is this coming from? And that's a question that can be pursued in a neutral way. It's not like the parent has to begin with the presumption that there is no way that this child, is transgender, and I'm not going to tolerate it. But it needs to be at least other alternative answers at least need to be looked at. And I've heard anecdotally several stories from people about Dr. Michelle Cretella, who's the executive director of American College of Pediatricians, is a pediatrician herself, has told a couple of stories. One about a child who's, let's see, I think it was a boy, and his parents had a younger child, a daughter, who had special needs. And so because the younger child had special needs, they had to devote a lot of time and attention to the younger sister. Well, the boy developed gender dysphoria, but then when they finally explored it with him, he said, well, you'll love me more if I'm a girl. He didn't understand that they gave more attention to his sister because of her special needs. He thought his parents loved her more because she was a girl, and that if he became a girl, then they would love him more too. If you just accept the transgender narrative at face value, you won't discover those things. And then there may be physical problems. I mean, I've also heard the anecdotal account of someone who, a boy who said he wanted to cut off his penis. And at first people thought this boy was transgender, serious transgender case. It turned out he had a medical problem which caused him a tremendous amount of pain in his penis. And once they were able to resolve that medical problem, he didn't want to cut it off anymore.
Wow.
So,
yeah, kids are amazing. And that's something that I had no idea. And I mean, really, I haven't started talking about this until fairly recently. But as I started talking publicly about the cause of my trans identity, I've had so many people reach out to me and say the same thing, that, that they had a sexual assault or abuse in the family, and that's what made them develop the gender dysphoria that resulted in the trans identity. And if we just automatically accept that a child is transgender, we may be overlooking something really serious that needs to be addressed.
Right, and some of the concepts we're accepting, if we accept this transgender narrative at face value, are concepts that we wouldn't accept in any other context. Like, I have also heard that in some cases, for instance, if you have a girl whose mother is abused, by her father, this girl may perceive that women are weak and women are victims. And if you want to have control of your life and agency in your life, that you have to be a man. And so that's not something we want to teach people. We don't want to teach people that women are weak and passive and only men can be strong and assertive. That's not what we want to teach people. That's not a feminist concept.
Or even the way that you define yourself as male or female is based on your external presentation, and often very extreme stereotypes of that.
Right, and that's another issue, that we are judging someone's gender identity based on stereotypes. That if a boy likes to play with dolls and wants to dance ballet, that he must actually be a girl. Well, no. Why can't he just be a girl why can't he be a boy who likes ballet? Why can't you have a girl who likes sports? So it's actually reinforcing gender stereotypes in some way. And the other thing that you alluded to, you talked about how they're told that people are born in the wrong body. There are lots of people who are uncomfortable with their bodies for one reason or another. Probably most people have something about their body that they're uncomfortable with. And if we are telling children that when you're uncomfortable with your body, that means you were born in the wrong body, that's exactly the opposite of the message we should be telling. Yeah, we should be telling people you were born in just the right body for you. And your body doesn't have to be like everybody else's body. You don't have to be your body doesn't have to be like the people you see on TV. But you want to take good care of your body, but you were born in the right body for you. That's a much more affirming message, affirming of the child, than to say, oh, you were born in the wrong body.
Yeah, and that's something that I just feel really sad about, is for children to get the message. I mean, that means they're inherently flawed, which is something that you can't get away with. If you were born in the wrong body, no matter how much you change your external appearance, you're still born in the wrong body. I mean, you're inherently flawed, and that to me is just such a damaging message to tell anybody.
Right. Yeah.
So I was wondering, since we have an election coming up, and depending on who's elected, things could change a lot. And you said that all these changes were made by an executive order, I guess, from President Obama, that allowed any child who identified as the opposite sex to access services and athletics and facilities of that sex. So in that case, all it takes is for a different president to come in who has said, Joe Biden has actually said that his #1 civil rights issue is transgender issues. So he's already said that that's going to be his most important issue. So can he come in on day one and overturn what President Trump has done and go back to the Obama era requirements of schools to affirm transgender children?
Well, he can try to, but this is the kind of issue that may ultimately end up in the courts, because part of the problem, and this was a problem with a couple of issues with the Obama administration, was they would interpret statutory language. They would adopt regulations, but the regulations have to be based on a statute that's been passed by Congress. And so what we felt they were doing was adopting regulations that were not consistent with the intent of Congress, with the meaning of the actual meaning of the statutory language. So that's something that can be litigated, but obviously that's, very time consuming and so forth. So these cases take years to go through the courts. So that's why it does make a difference which administration is in power, because these regulations can have a tremendous effect for a long time, even if they're not consistent with the statute necessarily. One thing that we're arguing here, just on a constitutional basis, is that important social issues like this should be decided by Congress. They should be decided by our elected representatives, not by unelected bureaucrats, and not, for that matter, by unelected judges imposing their own personal preference. So, for example, on this question that's currently before the court as to whether gender identity discrimination is illegal as a form of sex discrimination under the law, we feel that to say yes to that question, to say gender identity discrimination is already illegal because it's just a form of sex discrimination, that would be basically rewriting the statute that was adopted by Congress. The 1964 Civil Rights Act, Title IX, and 1972, Congress did not intend to protect people against gender identity discrimination, and therefore it should be up to, if Congress wants to protect people, wants to make transgender status or gender identity a protected category, then Congress needs to pass a law to do that. Now, Family Research Council would oppose that law as well, but in any case, regardless of how you feel about the merits of that issue, as a constitutional matter, it should be up to Congress to decide that, not up to the courts to impose their own view, and not up to any administration to impose a view that's inconsistent with the language of the statute. Both of these can be problems where administrations go beyond the language of the statute and basically rewrite a statute, and sometimes courts do that too, and basically rewrite a statute. And we think, we believe in the traditional view that the legislative branch writes the laws, the executive branch enforces the laws, the judicial branch interprets the laws when necessary, but they're not to rewrite the laws.
So just out of curiosity, with some of the Supreme Court cases that are coming up, are they contingent upon the courts accepting that somebody can be born in the wrong body? Or is there a way to sort of sidestep that? Because one of my concerns is that if the courts come out and say that indeed how you feel is more important than a biological reality, it seems like, I'm thinking about the slippery slope here, that if what I believe about my gender can be fact, then what about my age? What about these other things? So if the Supreme Court ends up accepting the concept that one's feelings defines one gender, then can you foresee sort of some of the implications of that?
Well, yes. I mean, this is the concern. I mean, one thing, again, this is an example of where I think the media coverage has not done a very good job of really explaining the issues. And this is something I'm feeling I need to maybe write something of my own to sort of express what I'm saying, what I believe. But at the heart of this transgender issue is that it's not a question of discrimination. That's what they want to make it about discrimination. Discrimination is bad. Everybody should be treated equally. And these people are being discriminated against because they're transgender. In a lot of these cases, the question is not discrimination. The question is because sex is different from race under the law. Basically, our laws against racial discrimination say that there's virtually no place where it's legal to separate the races. To say this institution is only for blacks and this institution is only for whites. That's illegal. But that's not true with respect to sex. And the courts have made this clear, that it is legitimate to have separate restrooms and locker rooms for males and for females, to have separate sports teams for males and for females.
That's what the feminists fought for, ironically.
Well, yes, yeah. That's to protect, particularly it protects women. Primarily, it protects women. So the question is not one of discrimination. The question is one of definition. How do you define who is male and who is female? And there is a philosophical conflict here. It's not a matter of discrimination or hatred or whatever. It's a philosophical conflict. There are some of us, more traditional people, who believe whether someone is male or female is decided or determined by their biology. It is determined by the body they are born with.
Because in fact, that's how we define sex. And so, I mean, yes, it's the definition of sex.
Yeah, even in the context of some academic things like the DSM, the Diagnostic and Statistical Manual of Mental Disorders, that's published by the American Psychiatric Association, defines the word sex in terms of biology and one's reproductive capacity. That's the specific sort of biological purpose that is served by sexual differentiation is the purpose of reproduction. So some of us believe that, which is the traditional view, but increasingly this transgender view is being promoted, which is that whether a person is male or female is determined by their psychology, not by their biology. And that if a person thinks they are male, then they are male. Or if a person thinks they are female, then they are female, but that determines what they are. Now, in some ways, it's irrational. This is really irrational.
It's really scary too, because what I'm thinking, like, even just, for some reason, I'm thinking about medical trials, and we have medical trials now. Recently, the Health and Human Services has strongly recommended that whenever we try medical testing for new medications or medical devices, that you have males and females, because males and females biology, the way they respond to things is different. Fundamentally different, and historically only men have been used in clinical trials, and they recognize that as a problem. And so now they've said we need women, but if we start having men who claim to identify as women in that category of women, it will undermine the integrity of the results. And so just in something just so basic like that, if we start to deny some fundamental truths, then we get into trouble.
Right, and it can negatively affect the health care provided to the transgender person themselves. So
yeah, there's a case. Yeah, if I think for heart disease especially, the presentations of heart disease in male and female bodies is completely different. And if you have medical records changed to support the idea that they are what they feel they are, then when someone comes in an emergency situation, they could get completely the wrong care.
Yeah, there was a tragic story a few months ago of a person who presented as male, who went to the hospital, I think went to the emergency room or something, with a certain amount of physical distress. And it turned out this person was actually transgender and was actually pregnant. And she suffered a miscarriage because the medical staff did not respond to this immediately as a pregnancy-related issue or complication, or did not treat her as a woman because she presented as a man. So, that's the kind of thing that can arise too. But anyway, there's this philosophical conflict between those who believe that male and female is decided by your biological sex, and those who believe whether you're male or female is decided by your psychological gender identity. And neither one it's not a matter of discrimination, it's a matter of a genuine disagreement about human identity.
Yeah.
And the law, well, it's certainly, I personally think that the biological view makes more sense, because your biology is more fundamental. It is less changeable. Your psychological.
Tested. It's empirical.
Right. It's empirical. And whereas with gender identity, you're reliant entirely on a person's self-report. I mean, it's a self-diagnosed condition, and that's a changeable one.
It's also somewhat confusing self-diagnosed condition, because it's very hard for me to understand how someone can claim to believe, to feel like something that they've never been. Because I certainly,
I feel like a woman. Well, how do you know what a woman feels like?
Right, if you've never been one. So it's sort of this strange recursive, and it gets very convoluted when you start talking about somebody having a female penis, and it just gets the whole language is getting really altered in a way that, for me, as a mother, I look at it and say, this is going to confuse the heck out of our kids. And that's something that really concerns me, is that I'm a strong advocate for children, and I don't want people doing things that are going to harm them. And when I start seeing some of this language and thinking, little kids they rely on adults to create reality and to affirm truth. And if we start having teachers and parents and doctors not doing that, then we grow up with a generation of kids who really don't know who to trust, don't know what truth is or how truth is defined.
Yes, that's a very good point. And I was going to mention that I've also heard anecdotally about children. You see, they're pushing this on children even at the very youngest ages. And I just don't believe that young children are capable of processing the idea of somebody who is a boy but wants to be a girl or something like that. And so you have some children who because they're not even cognitively capable of processing this, they misinterpret what they're being told, and they may think you may have a boy who thinks he's going to turn into a girl. Not that he wants to be a girl. He doesn't want to be a girl. He's afraid he's going to turn into a girl.
If he acts like a girl, he might turn into one.
Or vice versa.
Right.
I mean, and so that's not actually what they're being told, but they're not capable of processing what they're being told. And it's just tragic that, because I do feel that developing a secure gender identity in the sense of being secure with being a male or being a female is a very important developmental task for children. And this transgender movement is completely disrupting that task for many, many millions of children. And that's really unconscionable.
Well, we have just a few more minutes. Is there, in the last few minutes, is there anything that you want to really emphasize, or something that you haven't talked about that you want to share?
Well, I've been working while in quarantine with the coronavirus, working from home, a lot of my time on a more extensive paper dealing with this issue of gender transition medical procedures for minors, which is what you and I were testifying against in Alabama. And so I've drafted a fairly long and detailed paper on this, which I can't tell you when it will come out, but I encourage people to be on the lookout for that at the FRC, Family Research Council website at frc.org. And really looking at some of the details and offering some documentation about the issue of puberty blocking hormones, which prevent children from going through normal puberty if they are identifying as transgender. Then the cross-sex hormones, like giving testosterone to females or giving estrogen to males. And then the gender reassignment surgery, which, although it may not usually be done on minors, it's increasingly being done on minors.
13-year-olds are having their breasts amputated.
Yes. And so I go through all of that. And then I go through some of these issues about the question of, is this really medically necessary? Is this actually evidence-based? This is the buzzword in medicine, that things are supposed to be evidence-based. But in this case, they abandoned that requirement, and I remember it striking me once, the first time I read that some of these transgender guidelines are consensus-based. Well, if it's consensus-based, that means it's not evidence-based. And every other
they do use is just it's so flimsy, and I feel like one of the things that they're doing is that most people don't have a good research background, and so when they see a study, they're not able to take it apart and understand how invalid it is. And I don't have a great background in that, but I do know that if you have people who volunteer to take a study, who have a certain political stance, and then ask leading questions, that's not a valid research study. And the vast majority of the studies that they're presenting as evidence for the medical transitioning are based on these self-selected, self-reporting surveys.
Yes, well, with respect to this idea of it being evidence-based, I went through the Endocrine Society guidelines issued a few years ago, and they actually talk about what the evidence is in support of each of their recommendations. And if you read through that, they admit that the evidence is very weak, or extremely weak.
Does that just scare you? I mean,
yeah.
To me, I'm like, these are children's bodies that we're interfering with their endocrine system based upon a philosophy and an ideology without medical foundation. And then when I start seeing, I'm sure you've looked at some of the short-term and long-term side effects of these drugs, and that's horrifying to me. And they're giving them to children based on consensus.
Right. Yeah. And then I also wanted to mention the suicide issue. And this is one of the things I mentioned in my testimony down there in Alabama, that there was just a study that was published in February of 2020 in the journal Pediatrics, which was widely touted in the media as supporting the idea that children who take puberty blockers are less likely to commit suicide than children who don't, and therefore than transgender children who don't. And but then I actually acquired the study and looked at it very closely, and that finding was about lifetime suicidal ideation. So that was about having thoughts of suicide and ever in their lifetime. So we don't know if they had the thoughts of suicide before puberty blockers or after puberty blockers or what. It's not expressed in there. But there was another finding in there which was not publicized because it wasn't statistically significant. But sometimes findings can be very dramatic, even if they're not statistically significant. And this one said that those who took puberty blockers were actually twice as likely to have had a suicide attempt that resulted in inpatient hospitalization in the last 12 months. Twice as likely as the transgender kids who had not taken the puberty blockers. Wow. So, you know, there is some evidence to suggest that not only will this not prevent suicide, but it may increase the risk of suicide. Also,
one of the ways that I see that happening is that puberty blockers not just prevent the body from developing, but they also prevent cognitive development, emotional development, all these important developmental functions. And if you have, you know, 15-year-olds who've been on puberty blockers and haven't had those developmental milestones, then it seems to me like they're more likely to have those thoughts, those suicidal thoughts, because they're not maturing in their thinking processes. And, you know, we all know little kids who, you know, when they don't get their way, their life is over. You know, it's horrible. I didn't get my way. But kids, you know, they go through puberty and they mature and they learn that their life isn't over and they'll be okay. But if you're on puberty blockers, you're not going to go through that developmental process whereby you learn how to handle negative emotions and just that cognitive development to be able to see things from multiple perspectives rather than having that very self-centered perspective.
Right. And I mean, just a general point, experts on suicide in general will say the vast majority of people who commit suicide have some type of major mental illness. So if somebody is threatening suicide, the response to that should be, you need counseling, you need to see a psychiatrist, and should not be, you need to change your body, you need to, you know, cut off some body parts. You know, that's not a rational response. When
there is no other situation I can think of where a client or a patient can go into a doctor and say, I'm suicidal, therefore give me these drugs.
Right. And but now I want to emphasize, every talk about suicide, every threat of suicide, every talk about suicidal ideation should be taken seriously.
Yeah, those are
but
kids.
At the same time, there is evidence, and this was brought out in the Lisa Littman study about the rapid onset gender dysphoria. There is evidence that many young people are being coached, are being actively coached what to say in order to get your demands fulfilled, including to threaten suicide. So it's possible, every suicide threat should be taken seriously, but in some cases, the suicide threat may be a tactic, a strategic tactic to try to get what they want, rather than you know, actually reflecting an intention to commit suicide.
What a powerfully manipulative thing to do to parents. I just can't imagine. And I even heard of a case where a child, actually it was classified as a suicide attempt because she took like 3 Tylenol and said she was trying to kill herself. And so that's actually now classified as a suicide attempt. Even though, I mean, and that's where I have to be very careful, because I don't ever, you know, I want to make sure that if a child needs help, that they get it. But at the same time, when you have activists coaching children to threaten suicide and also to perform something that looks like suicide in order to get what they want, it gets really scary, because then we don't know when a child really is in need of help and when they're just trying to get what they want.
Right. And well, and this is why in that one pediatric study I mentioned, I think it's very significant that that on this more serious, there are different measures of suicidal of suicidality. There are are suicidal thoughts or suicidal ideation. There are suicide attempts. There are suicide attempts that result in hospitalization, meaning that that was probably much more serious, a more serious suicide attempt. And then there are completed suicides, which are not captured by a lot of this research because the research is based on surveys of people who say they attempted suicide. Now, one study of completed suicides was the one in Sweden, where they found that people who had had gender reassignment surgery were 19 times more likely to commit suicide, to actually have a completed suicide, 19 times more likely than the general population in Sweden. So
that's just huge. That I can't think of any other population that is at that high of a risk.
Yeah, it was startling. So, we need to, this is the tragic thing, is that these children are not being provided with the mental health resources that they actually need. And they're serving an ideological, serving an ideological purpose rather than really serving the health needs of these young people.
Well, I appreciate all of your efforts, and I'm really glad that you're working on that project that you're talking about, because I think that there are a lot of states that are going to try and introduce legislation to ban the medically transitioning of children next legislative session, and having a document like that will be so educational, because I think most people don't know what's going on. And I know when I brought it up last year, I had a number of trans activists say, that never happens. We don't do that to children. We never had that. And a lot of people have no idea what's happening or the side effects and the long-term consequences. So I think that kind of document is going to be very valuable. And
well, thank you.
Yeah, thank you so much for talking to me today. I really appreciate it.